Hello students. So welcome back. Today I am going to tell you some important cases based on your first chapter of general anatomy. So I hope you already have gone through the first chapter of general anatomy where you find different positions of the body during the different in your clinical examination and practices. I tell you how these questions are going to frame for your university exam. Now, there are few examples which I bring here today for your this session, but I am going to discuss all such clinical scenario based questions in the coming classes only for my members only subscription. So, if you want to discuss such questions, if you want to have the clear concepts how the clinical questions comes from the different segments of the anatomy in your university exams, then you have to go at that part of the channel. So there are some examples how these questions has been framed. If you read this question is having the four positions in your option: lithotomy position, Fowler's position, Sims position, and Trendelenburg's position. Now that is clear that this question belongs to the first chapter of your anatomy, that is your positions of the body. Now when you will see the question is says that if 45-year-old male is about to undergo a rectal examination. So the key point is that the person is here for the problem related to the anal canal or the rectum, like piles or like some fissure or some pain into the local region. So there is a rectal examination is required and it is always a OPD basis process. Now the patient is positioned on the left side with the left lower limb is straight and the right hip and knee is flexed. Clear? So the one leg is straight, another leg is on the another leg in the flexed position. So what is this? Now I will show you the image which is describing this position. Now here you can see that this person is lying down on one side of his body and this limb is flexed at the hip and flexed at the knee. The other limb, which is the lower one on which you are lying, or the limb which is touching the bed, may be straight or may be folded. But why this position is there? Because the examiner want the proper exposure of the genitalia, and particularly here we are talking about your anal canal. So that's why this position was given to the patient, and this is particularly for the digital rectal examination. And what should be the answer? This position is known as Sims position. Clear? So this is how this question framed for the Sims position. Now if you'll go to the next question, now again you will find the four options which are related to the positions, and when you will see the question, it is a question related to the pregnant female and in the labor room and there is an active labor. That means what is the next process? The mother is going to deliver a baby. Now which of the following position is most likely to given for vaginal delivery? Now see, the word vaginal delivery is important because they are not talking about cesarean section. If it is cesarean section, then the position, all the options are wrong. Cesarean section done into the supine posture. But because it is a vaginal delivery, you need a special position, and that is known as lithotomy position. So what is lithotomy position? We have seen this is the lithotomy position where the mother is having the both limbs apart from each other. There is a flexion at the hip joint. You can see that this is the hip joint, so there is a flexion. There is a flexion at the knee joint. But dear students, these knee joints are supported from below. Now these are the two supports and there is a strap around the knee joint, or you can say upper part of the leg, which is supporting the legs to slip off. So that is the important position, and this position is given for the proper exposure of the vaginal canal for the doctor at its lower end. Clear? So that the doctor can monitor the downward movement of the head of baby during the vaginal delivery. So this position is the classical position given for the lithotomy posture. Now there is a one more question related to the complication in case of the lithotomy, because if suppose the labor remains for 8 to 10 hours, and if the patient remains in this posture for 8 to 10 hours, what will happen? This strap constantly create a pressure at this point of the lateral side of your upper part of the leg. Now at this point, when there is a tight strapping is there, it will lead to the paralysis in the muscles of your leg, and that nerve which is present here is asked in this question. So what is the question? A 28-year-old woman placed in the lithotomy position during again the delivery is vaginal, and after complaints of numbness and weakness in her leg. So what is this problem? This problem is that because of this long standing posture, some structure is compressed here. And what is that structure? So which nerve is likely injured? So here you will have a relation of common peroneal nerve, and that will come when you will learn the your lower limb. So when you will read the lower limb, you will realize that a nerve is known as common peroneal is very near to the upper end of fibula, and because of the constant pressure, this nerve compressed at this point, and patient will have the problem related to this nerve problems. Clear? Now there is a one more question framed again. Here you can see again there are 4 positions. So again the question comes from the same chapter. Now what the question says that a 65-year-old patient has complained of breathlessness. So what is the key feature here? That there is a dyspnea, there is a difficulty in breathing, that is the breathlessness, while patient lying flat. That means as soon as the person is in the supine posture, when you are lying on the bed, just on the flat position, there is a breathlessness. On examination, that patient is having bilateral basal cramps and there is a mild edema. Now see, these are the signs which are suggestive that there is an involvement of the heart. There may be some kind of cardiac failure, and because of this reason, there is a collection of the fluid into the lung is known as this pulmonary edema, and that is reason there is a abnormal sound or the cramps are there in the lungs, and patient is also having the collection of fluid under the your lower limb, that is known as pedal edema. But the important thing is that this breathlessness can be relieved for a while making a patient in one of this position. So the most important thing is that when you are having the person is not able to lying down flat, then which position you should give? Supine. Supine means the flat itself. That means it is not the answer because patient is already flat or supine. Now prone is not the answer because when you will give the prone position, you will have more compression on the chest. So that cannot be the answer. Lithotomy, I just discussed the lithotomy. In the lithotomy, you are also having the similar supine posture till your this back. So that is not going to make any sense. The only thing left is the Fowler's position. Now when you will see the Fowler's position, it is basically also known as head end is up and the patient is having the this straight bed, but what you have done, you have uplift the head end. So this upliftment of the head end is known as Fowler's position. So this will help the person to increase the descent of diaphragm. So this will help that patient is having the more descent of the diaphragm. So that will helpful into the taking the more breath. So in case of dyspnea, in case of breathlessness, generally this head up position should be given, and this position is known as Fowler's position. Clear? So in such a way, these MCQs has been framed for your university exam. And why I come with this part only, because I hope that most of the students have already done the first chapter of the general anatomy. So nowadays, what is happening into the new curriculum of your exam, university exam, that you are having a 20 marks question in paper 1 and paper 2. Both are based on your clinical application. So dear students, you should always try to unlock your potential, and with this type of the discussion on my channel, it is for very sure that you will have the more confidence, and you are able to crack all your 20 marks question. Because as soon as you will go ahead, as soon as you will go in the books, when you will change the volumes of whatever book you are reading, you will realize that there are lots of clinical applications which are given in the anatomy. But it is very difficult to read each and every clinical at one time, because these questions need the basic clarification. You should discuss each and every option. So on this channel, if you are able to join my membership, we definitely have more and more such discussion based on each and every chapter of your book. So I hope you like this and you will join the membership. Thank you.